Good evening and welcome to our COVID-19 update. I am Ladi Akeridoluale. Here are the highlights at this hour. Health Minister reaffirms non-approval of 4 categories of antibody testing kits in Nigeria. Lagos State government says open markets compliance with COVID-19 prevention guidelines is challenging as it unveils protocol for opening of places of worship. And from June the 15th, the United Kingdom makes face mask wearing compulsory in public transport. The Minister of Health, Dr. Osagie Ehanire, has announced that the Medical Laboratory Science Council of Nigeria has evaluated only 4 of the antibody-based test kits in Nigeria and that all 4 failed the validation tests. The minister, who spoke today at the national briefing of the Presidential Task Force on COVID-19 in Abuja, hinted that no antigen test kit has been evaluated yet, and that this means that results obtained from these tests are not tenable for diagnostics, being deficient in sensitivity and specificity, and are likely to give false results and mislead people.
To comment on the various test kits that are thought to be in use in Nigeria, especially the antibody-based test kits, I would like to advise that only 4 of those kits have been evaluated by the Medical Laboratory Science Council of Nigeria, and all 4 of them failed the validation test. None of the antigen test kit has yet been evaluated. But what it means is that results obtained from these test kits, they're not tenable for diagnostics, and they're deficient in sensitivity and specificity, and are likely to give false results and mislead people. NCDC certified laboratory in Nigeria is still the WHO-recognized PCR testing method, which gives us reliable results. Though expensive, this option is the right one.
In Lagos, Governor Babajide Sanwo-Olu says religious centers will be allowed to open in the next 2 weeks with a crowd capacity not exceeding 40%. The governor explains that the worship centers can only operate on Fridays and Sundays, and that the State Safety Commission will be going round to check the level of compliance.
On Monday, June the 1st, the Presidential Task Force on COVID-19 made a pronouncement on the reopening of churches and mosques, but with conditions.
For churches, each service should be for a maximum of an hour, with an interval of 30 minutes in between services to allow time for disinfection. Mosques may open 15 minutes before Adhan and close 10 minutes after prayer for Fajr, Zuhur, and Asr.
The Lagos State Governor, Mr. Babajide Sanwo-Olu, is taking it up from there, announcing more guidelines if religious services must hold.
Precisely from the 19th of June for our Muslim worshippers, and from the 21st of June for our Christian worshippers, we will be allowing all of our religious bodies to open at a maximum of 40% of their capacity. We will also be advising that there should only be mandatory Fridays and Sunday services. Persons below the age of 15, because of how well they walk around and how they become difficult to hold down, that they should be excused from the places of worship. And citizens that are above the age of 65, citizens that are above the age of 65 should not be allowed into these places of worship.
And for primary and secondary schools, a decision on resumption is yet to be made by the state government.
We will be engaging with the Ministry of Education, with the Lagos State Safety Commission, and we'll be coming out with a specific pronouncement. In 2 weeks' time, we'll be able to make a full pronouncement, once the protocols have been agreed with all of the various stakeholders at the primary and secondary school, as into when and how this institutions of learning, these schools will be opening.
Governor Sanwo-Olu rounded off his briefing saying that all events and social centers should re-register to reopen at lasgsafetyreg.com and appeals to residents to stay safe and adhere to all COVID-19 guidelines in order to reduce the spread of the virus.
While Governor Sanwo-Olu was giving the update on COVID-19 guidelines today, he also spoke about the state having a challenge in dealing with crowds, particularly at marketplaces. At a press briefing earlier today, the governor appealed to residents to make use of the makeshift markets created to reduce the number of people visiting the regular markets.
Really not about government alone, but it's about all of us, and that's why we keep ensuring that every 2 weeks we communicate with our people, explaining to everyone why this is so important. We still have our community markets that we're still running, and at the schools that we've had for like 2 months now, they're still running. And so we continue to have conversations with the market leaders, the yarlodgers and the babalodgers. But you see, it's a population thing, So we said to them before, on food markets are on Tuesdays, on Thursdays, and on Saturdays. The non-food market are Mondays, are Wednesdays, and Friday. That is still in place. We're hoping that people will just understand and see the need for people to be able to take full responsibility for this. And even for the sellers to insist and ensure that basic things are kept, both in the market and also the consumer as well. We've seen a lot of, hand washing exercise. We've seen a lot of, sanitizer being deployed at the market, and we needed to commend them. It's really just around the crowd that has to keep surging in. And this is a population, challenge that as a state we need to contain with.
On the vexed issue of markets, the Kano state government on Monday announced that the ongoing lockdown will allow all markets in Kano's commercial city to operate on the days of easing the lockdown, which were Wednesday, Friday, and Sunday. Traders and customers have expressed a sigh of relief that they can now go about their normal businesses and also earn a living so as to put food on the table. Channels Television entered the markets and monitored how much compliance was given to measures taken to stay safe.
Markets in Kano State under lock and key following government lockdown order due to the rise in cases of COVID-19 in the state. 5 weeks after, the markets are reopened as government eases the lockdown. The markets are back to operation, although only for 3 days of the week. Some residents consider the opening as a good decision.
This is where I take my daily bread. But since when lockdown come, no food, no money, I really feel bad because there is no money in my hand. But now, so much thank God, as God touched our government mind to open this market now.
I'm happy, honestly speaking, because all this while I've been inside the house. No money, money is not entering my hand. But today, at least, it makes some sense.
While they promise compliance with safety measures, the traders call for more.
These 3 days will not okay for us. At least they are put Friday and Sunday. They have to put 5 days at least, so that Friday people should stay at home, then they'll go mosques. Sunday people should stay at home, then they'll go church. That 5 days now, people come and look for what they want to eat.
And the state government promises to do its part.
We have already spoken to the leadership of some of these markets, and we are trying as much as possible to ensure that there was virtually no disruption during the relaxation, and that most of the areas that have been congested has been noted. And I want to believe that during those days in the future, I think we are not going to experience such things we have seen.
As of the last count, Kano State in northwest Nigeria has the second highest case of COVID-19 in the country after Lagos, with 970 cases and 45 deaths.
eye care practitioners have warned that computer screens and devices produce harmful blue lights which affect the eye. Speaking to Channels Television on some of the dangers of long exposure to screens, especially during COVID-19, the medical director of Dothan Eye Center, Dr. Nene Opara, recommends the use of anti-glare and blue filter lenses to protect the eyes. Dr. Nene also wants parents to constantly interact with their children who may not be able to express themselves in terms of what is happening to their health. Our correspondent, Olu Phillips, has that report, especially against the backdrop of increased internet usage at this time.
One of the huge fallouts of the COVID-19 pandemic is the interruption, the digital upsurge it has introduced in almost everything we do. Human nature is one which supports a lot of interaction, face-to-face engagements, and contacts. As advised by the World Health Organization, in addition to various recommendations, social distance or distancing is now the latest and most popular buzzword, a global phenomenon by all manner and intents. What does that mean essentially? The world, its population, business, communication, play, interaction, and many more are now conducted by a digitally mediated platform. Although such practice isn't a new development, what is, however, obvious is the traffic it now generates. People have left the streets and reached for their devices. But like most trends in life, with increased attention at anything and endeavor, come heightened risk and challenges.
The three main factors for successful e-learning: 1,
children are now staring at the computers longer hours than they had before COVID-19.
Long exposure to television screen, computer, smartphone, tablets can lead to an eye condition known as computer vision syndrome, also referred to as digital eye strain. This shows its symptoms as pains, irritations in the eyes, dryness, blurred vision, and over time there's a degeneration in the retina. If not attended to, there will be age-related macular degeneration and cataracts. You also apply the 20-20-20 rule. For every computer user that is always on the system, for every 20 minutes, take a 20 seconds break to look at a 20-feet distance object. That helps you to relax your eyes. Thirdly, learn to blink. Blinking helps you to lubricate your eyes and helping your eyes to stay moist and healthy.
All manner of applications have now been activated for online lessons, lectures, meetings, worship services.
Holy Spirit knows.
Even court proceedings have now commenced digitally, with a record of one person jailed.
The defendants had worked with me from 2013.
Are there inherent dangers like catfishing and viruses? Can some of these high-powered meetings and deliberations be hacked or identities of executives compromised? The cyberspace is now the biggest convergence place and ultimately may be requiring the power of a 5G speed, irrespective of the conspiracies around the technology. Hopefully, we will continue to interact online with reduced risk or increased security. It's just a matter of two sides to a coin. Olu Phillips, Channels Television News.
We're taking a look at this new phenomenon on our society since the outbreak of the COVID-19 pandemic, the increased use of online communication and the various platforms. Joining us to discuss this is a cybersecurity expert who joins us via Skype from Akute in Ogun State, Mr. Olatunji Matthew. Good evening, Mr. Matthew. Thank you for your time. Do you have any idea of what the level of usage is of these online platforms vis-a-vis what it was before COVID-19?
Yeah, thank you for having me. Basically, before COVID-19, we have the normal conventional users of internet who perhaps make use of internet for business purposes. But during the outbreak of COVID-19, there was a very huge increase in individual making use of internet. Even people that are not so tech savvy, they have to resort to making use of internet because that is the only means for them to, to stay abreast of what is going on in the world and even stay abreast of situation of things around them and also to keep them alive. So there is a very huge increase in numbers of users of the internet, even people that are not so tech savvy. So that means that the outbreak of COVID-19 result to a very high huge, in the people coming on the internet to actually stay abreast of what is going on in the world.
Does that have anything to do with what some have described as the quality of service that has attended that in terms of the bandwidth available for people? Because of that increased usage, some have said the quality of the service has dropped. Some of the things that we are used to getting quite fast have reduced in terms of, or rather have increased in terms of the amount of time it takes either to upload or download, things like that.
Absolutely, absolutely, because it's also a very huge business for the service provider. So definitely there is a very huge surge in the bandwidth usage. People who subscribe these days now, you could, for instance, I had an experience. I subscribed about 25 gig for a month, and in less than 14 days, it's actually on. I mean, I'm left with no bandwidth anymore. So, it's also a very, good opportunity and a business opportunity for service provider, ensuring that the increase in numbers of bandwidth usage is very much on the rise. And you subscribe today now, and your bandwidth is actually hard in no time. So, I mean, that also increased productivity and business opportunity for service provider, which is not so efficient for users, if you look at it, so to speak.
Given the fact that so many organizations, I mean, we've been talking about individuals so far, but many organizations themselves are now having to conduct quite a lot of business online, particularly in the era of physical or social distancing. So many meetings, even statutory meetings, annual general meetings and so on, are largely being conducted online. Is there a fear for the security of the kind of communications that go on platforms that are used for those purposes, do you think?
Yeah, absolutely. I mean, quite a lot of organizations are not so prepared for the outbreak of the pandemic. It actually caught most everyone unaware, and the organization has to invoke what we call an emergency incident response resilience plan, which most organizations don't even have a plan. So because, business has to continue, it's all about business productivity, it's all about business functionality. So a lot of organizations have to roll out a platform without even considering the security of those platforms to enable business to continue. So, the challenge now is that what is the security of the platform? How are they been able to manage security of remote working? So, I mean, it caught almost everybody unaware. Only corporate organization who has been practicing what we call cybersecurity best practice, or people who have been motivated by regulatory requirements. They have a regulatory requirement to meet. Might find it quite easy. Not so easy, but at least they are able to build on their security architecture. To roll out their remote working policy. But quite a lot of organizations who are not so so savvy, who have not even moved their business to internet, have to quickly look at the infrastructure that is available to them without even thinking about the security implication. So organization has to move to internet based e-business, to continue business and ensure that continuity of business is ensured, without security in mind. And that is why we are having so much increase in cyber attack, during this outbreak of a pandemic.
All right, thank you very much, Mr. Olatunji Matthew. Thank you so much for your time. Mr. Matthew joins us from Akute in Ogun State. Thank you for joining us this evening. When we come back from the break, I'll be taking up what Mr. Matthew said in his last comments there about taking up usage of platforms without checking on the security. But that'll be after the break. Thanks for staying tuned. Welcome back to our COVID-19 update. My next guest has been deeply involved in the last couple of years in managing systems and ensuring that they are not vulnerable to attacks. And now with the increased usage of these various platforms, I guess his role has become even more important. I'm being joined here in the studios by Mr. Ajoche Rock, who is also a cyber security expert. Thank you for coming in. Now, from what Mr. Matthew, who spoke before the break, mentioned, a lot of people have migrated to these platforms out of necessity, not necessarily because they wanted to or because they understand how they work. So that leaves them vulnerable and leaves them the information they pass on these platforms, even the documentation they pass on these platforms, vulnerable. Given your experience in this area, would you say Nigeria is better prepared to tackle this aspect of the challenge?
Okay, thank you for that opportunity. First, I would say no one is really prepared because COVID-19 just took us unawares. But it's important I mention that Nigerian government is doing a lot in addressing this. I know as at April, the Central Bank of Nigeria, the apex financial regulator, did a press release on what financial institutions need to do to protect the data of their customers. And that's been said, though it's not as holistic as it should be, but research has shown that there are so much new vulnerabilities people are exposed to while using third-party platforms, especially now that people work from home. Yeah.
Now, there are the issues of video conference meetings, virtual meetings, sometimes involving dozens of people, where highly confidential information is passed around and so on. How vulnerable are these systems, for example, to hacking?
Well, all systems are vulnerable. It just depends on the level of security measures, in-depth security measures you have in place to address it. First, from the corporate world, where I'm very familiar with, you have situations where the entire customer service unit of a bank has been told to do on a rotational shift. Work from home today, this week, next week, you resume. In that light, people use their own systems sometimes to access company resource. And what most institutions do, financial and non-financial, is to provide VPN access. But we've actually seen where fake VPN alerts have put people at risk, you understand? Like recently, even last week, it was on Global News. What is fake VPN alert? You just, from your personal system, you're connected to your office system, and you have that sense of security. But you just see a pop-up coming that your VPN is, click here to reconnect. Meanwhile, it's actually a fake alert. And how does that pop-up come in? Third-party websites, you use your private system to access, where you give them access to show you notification from the top left corner of your screen. And when you give a third-party web access, they can pop up anything on your system. So if they cajole you to click and it takes you to a malicious website, you're going to be vulnerable. You have no idea what they put. If they even take you to a look-alike platform, like if you understand. Office 365 was a major target in this. That was what happened. And in that specific attack, corporate users were putting their credentials, username and passwords. Unknowing to them, they're just sending all their details to a malicious actor somewhere. In that light, they have been hacked. They are vulnerable, including the company's financial assets. So in that light, there's so many vulnerabilities. Now, what the company needs to do in this regard is first, awareness. Secondly, ensure endpoint security. Endpoint security just simply denotes that you secure all your endpoints. Every system that is going to be customer-facing, that is going to be staff-facing, you make sure they are compliant with the latest security, in compliance with global standards, ISO 27001 and all that. So, but just like the other user mentioned in Akute, it's actually a behavior that most financial institutions are actually doing because they want to stay compliant to regulatory requirements.
Not necessarily because.
Not necessarily because, you understand. So when you now look at that chunk of percentage of people that are vulnerable, and you now look at those non-financial, it's quite large. So Nigeria is really exposed. Back to your question. So in that light, what the government needs to do is to push out security awareness initiatives on a broad scale, both at government levels, and individuals need to be careful how they use their data.
In terms of the service providers themselves, who people are paying, and a number of those I've spoken to say that in the last 2 or 3 months they are smiling to the banks, because even people who were not tech savvy, going back to what Mr. Matthews said, are finding that they're using more of the applications online in order to be able to communicate at various levels. What are they supposed to be doing? What are they doing, if they're doing, and if not, what are they supposed to be doing to ensure that those who pay for those services first get quality, and then secondly, are not exposed to these vulnerabilities that you mentioned.
Okay, thank you. Thank you for that. So first, it's important to bring to light that not all incidents, cybersecurity incidents, is being, sometimes the service provider has not little or nothing to do. It's just the individual themselves exposing themselves to malicious activities, you understand?
By their own work.
By their own work. Sometimes, and COVID-19 has also brought out some realities. A spike in unintentional insider threats. What do I mean? And this is also where a lot of government institutions, a lot of corporate world needs to be careful with. You have a situation where the entire board is having a video conferencing meeting, discussing about sensitive company information, strategies, and you have different users recording it. You have to know when not to and when you should record. If you're not authorized to record, you shouldn't record your screen. But when you're working from home, you can actually record your screen, and there's no the management does not know you're recording your screen. So this is how unintentional insider threat comes in. Do you understand? So in that capacity, you need to know that that video you're recording is not your data. It is the data of the company. So people do not still understand the level of implication they expose their company to when they do things like this.
From private.
You understand? So that's one side. On the service provider side, yes, I don't think there's really much a service provider can do. But however, what they could do is to actually push out security awareness tips to their end users. And it's also important we give kudos to the banks. A lot of banks have been doing this, a lot of Nigerian banks. Funny enough, Nigerian banks are really stepping up their game. Some are actually, they've opted for security as a service, you understand? So they are really doing well in that regard, in sensitized, because the case is monumental now.
Yes, because I was going to point out that a lot of people, because they can't go physically to the bank anymore because of the issue of distancing.
We've had countless cases, even I personally involved in investigation, and you understand, in this to establish evidence that you have been hacked and why you should be hacked, how you were hacked. So such instances, individuals need to first ensure that there was a study that revealed that breach victims do not actually reset their password, change their password.
They keep using the same
password. There's another lie to this. Sometimes users are lazy to say, okay, and you won't actually blame people. We're all human beings. You have your Yahoo password, you have your Gmail password, you have your corporate password, you have everything password. So sometimes you may just be lazy to just say save on browser. You understand? Now you're not in the office. Nobody is going to mandate you. This is a core IT function for all users to, how corporate enterprise check their staffs is through a technique called minimum password length and maximum password age. Maximum password age is the time it will take you, the company is going to force you like 30 days to reset your password. Once you resume to your desk in the morning, once you try to log on to the AD, to the Active Directory, it tells you to reset your password. But now you're at home, you're using your own personal devices. Those operational controls are not there. So you are using a password that is six months old. You're using a password that is the same password for your Yahoo account, for your personal account. Do you understand? So it creates a lot of vulnerability, risk, you understand, both to the user and to the corporate world. Then on the side of quality QoS, on quality of service, the truth is, there's going to be a spike in internet usage. Currently, Nigeria has, if not one of the most, I think has the most internet, we have the most highest internet density in Africa, you understand? So coming into COVID-19, first, you're going to have poor QoS, except service providers scale up their infrastructure. If they don't scale up their infrastructure, it's going to affect users. One of the major areas that this creates a concern is in telehealth. When hospitals rely on video conferencing
to be able to
diagnose patients. When you have poor QoS on that service, you know the ripple effect. It's more worrisome when you need to administer on patients who don't even, they are in resource-constrained areas, who don't even have the network at all. You can imagine that kind of thing. So these are some of the issues government needs to come in, involve, and ensure that there's robust capacity for companies to churn out their services.
A bit technical, but I'm sure that a lot of our viewers can follow that. Mr. Dirty Rock, thank you so much for your time. Thank you for coming in. Mr. Rock, of course, is a cybersecurity expert. And Even though that sounded a lot technical, there are many of those who are watching who will understand that these are some of the things that need to be addressed. Nigeria now has 11,166 confirmed cases of COVID-19 after recording 348 new infections in 18 states and the Federal Capital Territory yesterday. The Nigeria Center for Disease Control, the NCDC, also puts the number of patients discharged at 3,329 and 315 deaths. Of the 348 new cases, Lagos has 163, the FCT has 76, Ebonyi 23, Rivers 21, Delta, Nasarawa, and Niger 8 cases each, Enugu 6, 5 cases each in Bauchi, Edo, Ekiti, Ondo, and Gombe, 4 in Benue, 2 in Ogun, 1 each in Osun, Plateau, Kogi, and Anambra states. Lagos in the southwest still has the highest number of cases with 5,440, followed by Kano in the northwest with cases unchanged at case numbers unchanged at 970. The Federal Capital Territory in the north central region maintains the third highest tally in the area with 763 cases. Borno still maintains the highest tally of 296 in the northeast. Edo leads in the south-south with 341, while Ebonyi still leads in the southeast with 63 cases. Well, before we go and take a look at the medical side of what is happening to increased internet usage, the advent of COVID-19 in Nigeria has moved most social, commercial, and official activities to the cyberspace, allowing the use of the internet by many Nigerians. Kaduna State's residents are not left out, as they say it's been productive in this phase of the lockdown.
The coronavirus pandemic has driven many commercial and social activities online, and for some, the internet has become an ever more crucial link to those they love and the things they need. Majority of the residents of Kaduna, especially adults, say the internet has been essential to them during the COVID-19 lockdown. With many quarantined in their homes due to the lockdown, internet users say they have been able to interact with their loved ones and even conduct their businesses online. However, there has been rekindled debate on the usefulness and the potential challenges in the increased usage of the internet during the COVID-19 lockdown.
Sitting room now. So if you go into the sitting room, look at there's another feature. Click on channels. Okay, you don't even remember the channel.
For Nuhu Gwamna, a photographer, and Femi Adi, a journalist, both based in Kaduna State, the availability of the internet, although expensive, has greatly enhanced their job despite the coronavirus lockdown.
When you're locked down, you should know that the alternative to interaction and social, meetings will be done via internet. I discovered that the use of phone, computer to communicate, to even have conferences, just like webinars, and I've done 3 webinar meetings via online. And of course, you use the internet to facilitate this. You buy data, you connect yourself to people around the world within your constrained, defined environment. That's what we've been doing.
You have multiple people asking for a particular picture. You have multiple people that want to make use of a particular document. It becomes efficient when I'm at home and then all I need to do is to take these people on the same platform and discuss this particular thing and then send these images to them and then we discuss it. But during office hours or before the COVID, sometimes you send to these, you have to come back. Sometimes you have to be in the office before most of this transaction take place.
Before the pandemic, investigations showed that there is still a fair share of population that is not digitally connected in some way. However, the lockdown has prompted many to opt for the internet, at least to carry on in their daily activities.
Now, looking at the public health angle to this, we've been joined by a public health physician, also a sustainable development expert, Dr. Oladapo Asiobi. Thank you for your time.
Thank you very much.
Of course, I'm sure you listened to the technical side of the discussion. But now coming to the medical side, one of the things is that increased usage also means that body parts are exposed, particularly the eyes and so on. But in general, this increased usage, from the public health angle, do you have any fears?
Well, I have to look at it from the personal perspective and the public perspective. So, personal perspective, we're looking at it reduces your mobility, and then it exposes you to things that have to do with not moving too much, having a sedentary lifestyle, and then increasing lack of exercise. And those also increases your metabolic disease exposure, like diabetes, like hypertension. Then for those who are prone to having what we call a deep vein thrombosis to staying in one position for too long, and then that puts you at risk of other things like pulmonary embolism, which are very rare, but it can happen. So that's on a personal level. Now, on a community level, it's a tale of two cities.
How?
One city it makes the cup look half full. So, I mean, on a positive note, that's what I mean. So, it reduces how many people get on the streets, and so less transmission. Then, on the other end, it also helps with reduction in stress. I mean, traffic should be less. If
people are not moving.
Exactly. So, stress, transport-related issues, exhaust, ozone layer, regeneration. So it was like for some 2 months, the earth breathed again. There was more carbon, there was more oxygen by the trees. Then you don't have the factories flaring up things that depleted the ozone layer. So that will be on the good side. Well, maybe on the negative side, I mean, people are indoors. Then, of course, increases family and social bonding. But at the same time, it could also be too much. Familiarity can bring contempt in some areas. So those are social challenges. So it's either or then, exactly.
But that then leaves, of course, as you pointed out, there are medical risks to it, even though you pointed out that they're a bit rare. Before COVID-19 came along, the risks, I know that there had been medical practitioners who had said, leaving the phone in your ear for too long, which was where the whole issue of AirPCs came along for people who spend a great deal of time on the phone, and then exposure to screen glare for those who are on the internet. And with the increased usage, could more people be affected by that? There was one of the respondents in Olu's reports who talked about the eyes and the exposure, particularly with children who are now doing e-learning.
But I don't think it will be that long. I don't think children learn they don't spend as much time with the e-learning like they do in class. I mean, for most schools, let's talk about the preschool, the young age, they usually start school by 9. By 1, they are done. I'm not sure you do 5 hours in the stretch looking at the screen. Most children would have lost them. So when you do 20, 30 minutes, they go for a break, they talk, they interact with the family, they go back for another 20 minutes. And I think that's fair enough. However, glaring into the screen, I think things that make children glare to the screen for too long are not really the educational one. They are doing the video games. Because that one takes the attention, they don't get bored easily. They leave the headphone there for too long, so you have a hearing problem. But not with the 30 minutes, 20 minutes.
The formal
thing that doesn't go on for 3-4 hours. No, it doesn't. I have children, they don't stay in their classes for 20, 30 minutes.
You can't hold the attention
of
any youngster for that long.
No, it's even funny. The school complains that the children will put the tablet there and type 1 or 2, 3 things, then go and drink Coke or something, stay away for 5, 10 minutes, then come back and the teacher, where have you been? So, funny enough, they are saying everybody must get engaged. So you see the tutor saying, I've not heard you talk, I've not heard you talk. So you can actually leave the screen there, but you're not looking at it. You're doing totally something different.
This would be something you'd recommend for adults, because definitely, if we can't say the children are that way, the adults definitely are that way, even before COVID-19.
Yes.
You have adults who spend hours in front of their computer for work and related activities.
And they are at work. It's not that they were working from home. They were working at work.
Many of them were at work.
They were working at work, but spending so much time on the screen. And we always advise for ergonomic reasons. I mean, sitting down in a position for too long is not good for you. Whether working from home or working at work is really not good for you. I mean, your back is strained. Most office environments don't have the proper chair for the proper work. So you have back pain and all that. That's where you get all those things from. Then you have the nibble thing, the finger thing, they type for too long.
Which eventually goes to hit the fingers.
Exactly. But the one at home is more of leisure. You walk, spend 20 minutes, you go do something else, mingle, say some other thing, come back. So, yes, the increase in number of users, yes. I mean, I was just looking at the internet. Zoom went from 10 million in December 2018 to 200 million in March. That's like 20 times. But it is not the hours. It's people who log in, they were tracking, not the number of hours they use.
That each individual spends.
Exactly. But so I think we shouldn't make too much of it.
On balance, it is not yet something that should concern.
Yes, however, we should not close our eyes to it. So this is time for people who are interested in research to really now track, okay, so for how long were you on the screen? People should take time out to document and record for how long was I on the screen per time, so that when we see things come out of it health-wise, we can know what to attach it to. Because a doctor will only know the record you give. It's like going to the doctor and saying, I have hypertension. The guy will ask you, what has this been in the last 6 months? You have no record. The guy can say no, nothing. He can only start from now. So people should keep tab of how long they use, how long they spend on the screen, so that when issues come, we can know where the problem came from. Yeah.
Thank you so very much,
You're welcome.
Dr. Oladapo Asiobi. It's been enlightening to have this
My
side
pleasure.
of the conversation. Thank you so much.
Good luck and stay safe.
Thank you. Thank you very much. Same to you. Let's go now to the United Arab Emirates, where our correspondent, Mayowa Adegoke, is with us. Mayowa, good evening, and trust that all is well on that side of the world. The private sector in the UAE has opened up 100% in terms of its capacity.
Definitely. Good evening, and it's good to be back. Definitely, we're keeping safe. And yes, the private sector has been given permission to open 100%. Malls have also been given permission to open at 100%. But of course, government continues to let people know that they must put safety measures in place, social distancing, and all the other rules have to be in place as well. And we've seen that at least a couple of companies are still holding back, saying that if they don't need to, they wouldn't have all their staff return to work at the same time. So people are also taking personal responsibility in making sure that they don't just rush and go back to business as usual. So that's the current situation as of now.
Here, part of what has been in the center of discussion has been the issue of reopening of places of worship. The situation in the UAE talks about sterilization of mosques in particular ongoing, but nothing about when they are going to open.
Yes, so we've seen on social media a number of videos going viral of mosques being sterilized, especially in Dubai. Mosques, parks around them, and I believe it's an indication. A lot of people believe this is a positive indication that in the coming days, very soon, hopefully, that the government would make a statement regarding this, because then again, it is a government that is carrying out this sterilization exercise. There's been no official word yet, but there have been guidelines cited as some mosques as to rules and measures that need to be put in place. For instance, they're saying that when they eventually do open, of course, prayer times will be regulated. People will need to bring in their personal praying mats. There will be more spacing between, each faithful person, each person who comes to pray. So many things put in place already, although no official word as to when the mosques will open. But people are saying this is an indication that very soon something will be said. I also must mention that for government workers, they've returned 50% capacity, can now return to work. And in about 2 weeks' time, they expect that this will be increased to 100% capacity. So things are pretty much, I say 85%, 90% back to normal over here.
Thank you very much, Maiwa, for your reporting, and do continue to stay safe out there. The United Kingdom's Transport Secretary Grant Shapps says from June the 15th, face coverings will be mandatory on all public transport. Speaking at the daily COVID-19 news conference, Mr. Shapps says passengers who refuse to comply will be refused travel or fined. The new rule will be enforced by staff and British Transport Police. The announcement comes hours after leaders from around the world attended a virtual global vaccine summit with U.S. President Donald Trump also in attendance.
As the search for a COVID-19 vaccine continues, representatives of more than 50 countries, including 35 heads of state or government, have come together virtually to raise funds. The summit, hosted by the UK, aims to raise the funds to protect over 300 million children against infectious diseases like measles, polio, and now the coronavirus. British Prime Minister Boris Johnson called for donations of at least $7.4 billion. UN Secretary-General Antonio Guterres, US President Donald Trump, and African Union Commission Chief Musa Faki Mohammed were among others who made opening remarks at the summit.
First, let's find safe ways to continue delivering vaccinations even as COVID-19 spreads. Second, let's use the networks of vaccine delivery to deliver a range of other primary health services. And third, when a COVID-19 vaccine becomes available, let's make sure it reaches everyone. Diseases know no borders.
The coronavirus death tolls in Brazil and Mexico have soared to new daily records, with 1,349 and 1,092 confirmed fatalities, even as the countries begin to ease lockdown restrictions. Brazil now has more than 32,000 deaths, while Mexico has over 11,000. Over in the Middle East, Iran has reported a second day of more than 3,000 virus cases, sparking fears of a second wave of mass infections. Despite this, Iran is continuing to ease restrictions for many in the country.
From the World Health Organization, physical distancing is one of the most effective methods to limit the spread of COVID-19. You can find more information on how to protect you and your loved ones from the website of the WHO. And our website, channelstv.com, also has the latest news on everything, including the COVID-19 pandemic. All you need to do is log on and access the news in health, politics, business, sports, Africa, and around the world, all at your fingertips. Thank you for watching. I am Ladi Akiriduluale. Good night.